From high atop Healthcare Hill in Central Maryland, this is BSN Headline News. Today's top story is Bon Secours Virginia takes a bold new step for employee wellness. November 14th, 2011, Bon Secours Virginia Health System announced that they were adopting a nicotine-free hiring policy effective November 30th, 2011. As part of Bon Secours' investment in employee health and wellness, as well as our commitment to accountable care, nicotine users will not be eligible for employment within the Bon Secours Virginia Health System. Now, this policy affects only new hires and rehires. The new policy does not impact current Bon Secours employees, but we will remind current employees that Bon Secours Wellness provides a variety of resources for Bon Secours employees who want to quit. But why is Bon Secours Virginia doing this? The short answer is that if you are going to promote good health habits for your employees and the community, leading by example gets people's attention. And Bon Secours Virginia has been leading by example since implementing smoke-free campuses in 2009. According to Peter J. Bernard, CEO of Bon Secours Virginia, more than 12,000 Bon Secours Virginia employees care for and inspire patients every day. It is our responsibility to encourage our employees to be as healthy as possible and to offer creative and convenient ways to ensure their own health and wellness. And with smoking linked to lung cancer, heart disease, stroke, and other chronic lung diseases, it just makes sense. And Bon Secours is not alone. The Cleveland Clinic, Martha Jefferson Hospital, the Franciscan Health System, Mercy Medical Center in Des Moines, and the insurance giant Humana are just a few of the more than 6,000 U.S. companies who have already implemented similar policies. You can find out more, both pro and con, about this bold new policy for wellness by Googling the term Bon Secours nicotine-free, or go to Bon Secours Virginia's blog at bonsecoursgoodsharing.org. Bon Secours Virginia, finding innovative ways to be good help to those in need. In other news, last week we told you about the mandatory transition from ICD-9 to ICD-10. This week we are following up on that story with some questions that dig a little deeper into this transition. Questions like, who is affected by the new rules? In short, just about everybody in healthcare today. Physician practices, hospitals, long-term care facilities, home health providers, behavioral health providers, alternative site providers, health plans, and health care clearinghouses, just to name a few. Here's another question. When are these new rules effective? The timeline for implementing HIPAA 5010 is already underway and occurs in phases. Testing of electronic transactions began in 2010 and continued through 2011. Healthcare providers like Bon Secours and health plans must comply with the new standards for electronic transactions on January 1, 2012. Providers and health plans must implement ICD-10 code sets by October 1, 2013. And one final question. What happens if an organization does not adopt the standard? After the deadline, Medicare, Medicaid, and other health plans will not accept electronic transactions that are not in 5010 format. So, you can see this is important for all Bon Secours employees to be aware of and help out if asked. To find out more about ICD-10, go to IRIS and search for the term ICD-10. Finally, Patricia L. Robertson, CEO for Bon Secours Mary Immaculate Hospital and Extended Care Services, was selected as one of only 25 women in Hampton Roads who will be honored with the 2011 Women in Business Achievement Award by Inside Business Journal. The journal selects Hampton Roads area women for their professional and entrepreneurial accomplishments power and influence, and business community involvement. Pat Robertson was selected for her long-standing commitment to serving others both within the hospital setting and in the community. Look for the complete story and more on Pat's accomplishments in a special issue of Inside Business Journal, out December 13th. Please join us in congratulating Pat Robertson, CEO of Bon Secours Mary Immaculate Hospital and Extended Care Services, for this prestigious recognition of how she helps provide good help to those in need. Well, that's it for this week. Stay tuned to this portal for future up-to-the-minute information on these and other stories on BSN Headline News. And remember, Bon Secours is not just our name, it's our mission. I'm Dave Schlachter. Thanks for joining us. BSN Headline News is a production of Bon Secours Productions and is solely responsible for its content.